Today, we're getting under the hood of women's health with Dr. Kimberly Gordon, a double board certified psychiatrist, health equity consultant, and mindset coach. Dr. Kimberly will get under the hood of teenage mental health. What are the most common mental health challenges teenagers face today, and how can parents and educators identify early signs?
That's a great question. And in my practice, I'm seeing several predominant challenges for teenagers today, particularly in 2025. The most common include eating disorders, depression, anxiety, and I have to put a plug in for cyberbullying because that is something that our generation before did not experience. Some of the symptoms and signs that parents can recognize or any caregiver can recognize is changes in their sleeping patterns. That lasts more than 2 weeks. So we're not talking about just this, 1 or 2 days, but something that lasts for a while. Withdrawal from activities they previously enjoyed, and significant shifts in academic performance. All of these changes, in addition to changes in eating habits or physical activity, can be signs that a youth is facing some mental health challenge.
How do societal pressures like social media and academic expectations impact teenage mental health?
I think that's a complex question because young people today oftentimes are struggling with their identity and trying to find their place in the world. So, if we think about social media and what it is, it's a pressure cooker where you have this digital identity and you're here to perform, and it's almost this performance pressure. And you put that on top of the academic pressure to go to college, to have a degree, to have a good job. Many youth are asking questions like, can I afford to go to college? Am I going to be able to be a successful adult? This pressure, in addition to the pressure in social media to always look like you're doing good, to never fail, is oftentimes leading to a lot of anxiety and pressure in young people today.
How can parents and teens differentiate between normal teenage mood swings and symptoms of mental health disorders like anxiety and depression?
Elizabeth, I get this question a lot, and I just think it's so hard to be a parent today because oftentimes we're distracted. But teenagers' patterns are actually pretty complex. And so we have to recognize some of their mood fluctuations. But one way to do it is to think about the degree of the symptoms, right? So obviously, anybody can have mood regulation problems or difficulty sleeping. But if they're having it and it's lasting over 2 weeks, then that may be, something to look into. If the intensity of the symptoms are different than what you would expect from a teenager, that's something to look to. But also, most importantly, is it impacting their daily lives? Is it impacting their activities such as their educational achievements? Is it impacting their relationships with their peers or with others? I mean, young people today may isolate themselves from their family members, but also be doing really well at school or with their peers. And so it really requires parents to be watchful, but also to be understanding the patterns of teenagers today.
What role do evidence-based therapies such as CBT or medication play in treating teenage mental health issues, and how are they determined?
Interesting question and something that I'm always thinking about. Evidence-based therapies really just mean that this therapy has been researched across populations. And so, and for it to be evidence-based, that means it also needs to be culturally responsive, meaning many populations from different backgrounds have experienced results that are positive outcomes. But when I think about evidence-based therapies, I oftentimes do think about CBT, which is cognitive behavioral therapy. Cognitive behavior therapy has been studied with different populations, Hispanic youth, African American youth, even in Native and Indigenous populations, which means in a lot of ways it is our mainstay in terms of treatment for individuals, particularly teenagers and adolescents with anxiety, depression, suicide, and eating disorders and other disorders as well. In addition to that, medication management has been seen to be effective in youth who have moderate to severe depression or anxiety. We oftentimes do not use medications as the first line of defense, although people oftentimes think that psychiatrists and other prescribers prescribe medications first. We rely heavily on psychotherapy, particularly cognitive behavior therapy, to help youth when they have mental health challenges.
What advice do you have for parents on creating a safe space for their teens to talk about their mental health?
Case. I often talk about psychological safety. And youth, believe it or not, even though your parents, you raised them, you love them, teenagers change and they really do need that psychological safety with their parents. And that means that we have to recognize both the physical, emotional, and oftentimes communication barriers that happen with parents and children and youth. And creating a safe space for youth, meaning making it a physical place that's safe for them. Sometimes that's a quiet, private place. Obviously, teenagers always think that people are looking, observing them. And so you want to make sure that other people aren't hearing that conversation, making sure that they're comfortable, that you're being neutral when you ask them questions. You're not criticizing or judging, but really just there to provide an ear. I think that's the first step before we provide guidance. Obviously, parents want to provide guidance to their children, but you want to make sure that they are comfortable with the guidance first. You also want to actually think about the emotional part of it, right? If a person is an emotional mind, and by that I mean they're irritable, they're angry, they're upset, they're distracted, that's not really a good time to really sometimes engage in these conversations. But keeping that non-judgmental stance can help really validate the person's experience. It's also true that parents have to be consistent, right? Consistent and reliable is such a big part of providing that psychological safety and open up the room for those barriers that are there sometimes, especially when things are tense and when your teenager is just not performing or not meeting your expectations is really important.
How can teens better communicate their health struggles to friends, family, or educators without fear of stigma?
Ooh, stigma. I love that you put the stigma there because oftentimes that is the reason why young people are not, able to effectively communicate their needs. The first thing I think about is actually, having confidence, right? Having confidence in who you choose to be your audience to share, your journey with your mental health. You have to be careful with who you pick, right? And so I think it's really important for young folks to recognize that not everybody is the person to share some of those intimate journals you have. So really knowing who your audience is. It's also true that you have to lead not with fear, but like with a mindset that I'm going to get an answer, that I'm going to get results, right? Oftentimes when young people, they go and they speak to someone about a challenge, they may be leading with their fear, right? So one way to actually not lead with your fear is instead of saying, I'm so anxious, which is an I statement, you can say, I'm feeling like my heart is racing when I'm in class when I have to take a test. So it's really actually leading with helping us understand how to up with a solution. And it's also to just managing your emotions over time, like knowing that things will get better over time. Oftentimes seasons change. That helps young people feel better about their situation. But really, to address the stigma issue, it's really important that young people know that it's okay to share how they feel, right? Oftentimes, breaking the stigma is really just being open and vocal about what you're experiencing.
What are some practical strategies or lifestyle changes that can help teenagers build resilience and maintain good mental health?
Resilience is such an important thing for young people today. And I think a part of resilience for me is actually establishing appropriate boundaries with myself. And oftentimes, setting those boundaries means really setting aside a time to really connect with folks. Social connectedness is actually one of the social disconnectedness is one of the leading challenges that young people face today. And I think a lot of that has to do with social media and not being able to pull the plug. So I'm asking young folks to digital detox, right? And digital detox means just remember that all the things that's important for your health is important and you have to value that. That means sleep, right? Getting the proper sleep. Oftentimes when we sleep, it increases our, cognitive abilities. It increases our emotional abilities. It also helps us really to reset. In addition to that, physical health is so important. That means exercise and eating good nutrition, making sure you know what you put in and what you put out. And when you're exercising, remember you're releasing those endorphins and those happy, good feelings that everyone knows helps with our lifestyle and our health. In addition to that, one of the things that I think is most important, and oftentimes people forget, is the value of going outdoors. Right? Nature has a way of being very healing for us, providing for us vitamin D and all the other things that we need to just to feel good about ourselves and also feel good about the people around us. So I would encourage you to just remember all of those lifestyle factors when you think about how do I maintain good health.
How important are sleep, nutrition, and exercise for managing mental health during the teenage years?
I touched on that before, but I think sleep, exercise, and nutrition, I call it the three triad or whatever. You can't do one without the other, right? So if you're not sleeping well, you're not going to eat right. You're just not, and exercise also, if you're not sleeping well, you're not going to feel physically able to exercise because you're going to be too tired. But I think when you put those three together and you prioritize that and establish the right boundaries, you get results. So for sleep, right? Sleep helps us with resetting our body, giving our ability to rest. It helps with our cognitive ability and makes us more flexible, less irritable, help us manage our mood better. And oftentimes when we get in a really good deep sleep, it helps us to be more creative and innovative because we dream, right? So it's really important for us to sleep. For your nutrition, for instance, what you put into your body matters. I know that when you're young, you're thinking, oh, I have time, I don't have the metabolism issues, but it actually comes to you pretty quickly and you'll regret it later. What you put inside of your body means eating the right vegetables, right? Getting enough water, getting enough the nutrients that's going to be good for your brain development, but also good for your emotional development. Some of the stress hormones that we have in our body is related to what we eat, right? So being cognizant of what we put in our body to prevent those stressful situations is so important. And again, we all talk about physical exercise, but physical exercise is nothing without going outdoors. Got to put that in there. The best exercise is actually being outside, playing soccer, playing sports, doing things with people, even just going for a walk, a nice walk during the day can really help you. And again, exercise increases your endorphins, it provides stress relief, but it also improves the quality of your sleep and build your self-confidence as well.
What unique challenges do LGBTQ plus teens face in terms of mental health, and how can family and communities offer better support?
This is a complex question. And, in light of everything that's happening in the world, I just want to take some time and pause and just really acknowledge the LGBTQI youth who face challenges because oftentimes they don't see and they also don't feel supported. But the unique challenges are many, and it's actually a double stigma in some ways for some young people in certain communities. Oftentimes, this is related to, family societal pressures and acceptance of the youth's identity, particularly for those transgender youth today. In addition to the fact that many times young people are just really facing the normal, typical identity challenges, right? And so you're facing the identity development that's actually a part of everybody's journey, and then potentially actually feeling the unsupportive environments that you're growing up in, right? And these environments could be outside of your home. It could be in your school or in your community where you may feel support in one space but not another space. So it makes it even more complex. There's higher rates of depression and suicide in these young folks, in addition to, unfortunately, eating disorders and even substance use disorders is coming up in those individuals. It's also true that there's an increased risk of social isolation, right? Where you may isolate yourself from adaptive and normal, relationships and things like that just because of the stress that you feel. Oftentimes, these kids are highly resilient, can bounce back with the right support and the right mentor and the right guidance, which is very encouraging. But it's also discouraging that a lot of kids feel like they're out of place, that they don't have any place that they belong. The homeless rate for LGBTQI youth is on an increase, and that's due to a lot of factors, including rejection, right? Remember, rejection at this age is so devastating to the body, and it is traumatic. It's actually a form of PTSD that they're experiencing over the course of their life. So it's really important for us to have solidarity and support for youth, connecting them with supportive networks, in addition to understanding that youth are required to have security, right? We can't kick kids out of our homes, right? That just shouldn't be happening. Except it is happening. Sending these kids to support networks, allies, and people who understand them, but also advocating for policy changes in schools and in communities, I think will help with this issue. And right now it's very challenging because we're changing a lot of the policies related to DEI and others that, honestly, people don't want to talk about, but this is going to obviously affect this community and other communities as well.
How can schools play a proactive role in supporting teenage mental health? And what should parents advocate for?
Wow, I love the question of parent advocacy because oftentimes parents don't think that they can advocate for what happens in the school, but really we shape the culture of our communities and our ecosystem. So thank you for clarifying that. But I think, school-based mental health initiatives has been on the spread for many years now. However, many schools still do not have mental health professionals that work in a school who's a part of the school infrastructure. We understand that social and emotional health is actually under threat too in schools, where people are asking to take some of those, curriculums and agenda outside of the school framework. I'm a part of an organization called the National Council for Mental Well-being, and they have a mental health first aid. And I would encourage a lot of people to sign up to actually get training in mental health first aid. Even youth can get training in mental health first aid, which is really great. But the school plays a vital role in teens' health. It's a community unlike any other. It's actually a community where kids, for the first time, meet people from different backgrounds and experiences, but also learn a lot about their skill sets and their gifts and how they can be beneficial to the world. So one of the things that schools can do is really understand that mental health literacy actually happens oftentimes in school backgrounds, and so regular meetings around mental health, doing screening for kids in schools, in addition to providing spaces for kids that's safe to share what their challenges may be, is really, really important. In addition to having parent education spaces so parents can understand what is needed. As it relates to the question of parent advocacy, I would encourage every parent today to think about what youth are experiencing at school, right? Cyberbullying, experiencing the increase of gun shootings inside of the school. This is not a time where kids do not need supportive services inside of school. This is a time where we should all be advocating for school-based mental health services that's in their community, right? Kids shouldn't have to leave their school to get help. They should actually be able to get it in their school. And oftentimes that destigmatizes mental health issues when those services are provided in an environment where they thrive. So I really want to put a plug in for that as a school mental health clinician. It is really important for us to think about creative ways to make healthcare work for populations who just won't go to a doctor or who won't go to a clinic to get those supports.
What are your top 5 tips for teens struggling with their mental health to feel supported, empowered, and on a path to wellness?
5 things. Oh my gosh. So I think number one, I talked about social connectedness is prioritizing connections, right? Connections can happen with your family, but it can also can happen with your friends, and those connections have to be authentic. And while social media has its great points, it doesn't really foster always genuine connections. Now, not that one-to-one or group dynamics that you can actually get when you're engaging with a peer and a caregiver that you trust, right? So it really needs to be those trusted connections that are authentic and protected, right? In addition to that is developing self-awareness, right? So being self-aware is actually taking the time to be reflective and finding time for yourself to journal, or finding yourself your time to do something creative, something that you really like to do, that actually fosters a sense of identity. So when you're having challenging times, maybe your peers are not supportive, or maybe you feel alone, you have that sense of identity that keeps you strong, right? So having that awareness is so important. The other thing is actually creating balance, right? So we have to balance our, sometimes perfectionism, our need to actually perform, with just reality. Getting that proper sleep, getting that proper rest, getting that proper opportunity to like engage and have fun and take care of yourself is such a big part of that. Oftentimes, young people don't have mentors or peers or people that they feel are supportive. So, building your support team is also important, right? Your support team can be a coach, it can be a teacher, it can be a parent, it can be a family member, it can be a friend. But having a supportive team is so, 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 so important. And my last one, but the most important one, is practicing self compassion, right? We all make mistakes. We're all growing. There aren't any failures in life, it's just opportunities to grow. And so, really be careful of how you speak to yourself, right? Oftentimes, we can be our own worst critic. And that can actually be debilitating to someone with mental health issues, to constantly just berate yourself with all the things that you perceive you're not doing right. It's really important to just have some grace with yourself, and I think that grace with yourself will also help with grace with other folks as well. So it's such an important part of the journey of, I believe, mental health wellness.